Adib Ariensen will put on his game face this weekend when he shares his story to hundreds from around the world. He fled Afghanistan as a refugee and eventually settled in Canada. It wasn't safe for a young queer man after the Taliban retook the country in 2021. Ariensen had just turned 18. He crossed the border to Tajikistan, where the stress put him in hospital for a few weeks.
It was constant panic attacks, it was fear, it was just shock.
Now, the 23-year-old is speaking at a conference focused on refugee and migrant health.
I have the chance to raise my voice and advocate and do something that in the future, hopefully, it would get better.
But some of these conference attendees are worried the future may get worse. The Trump administration has heavily restricted refugee admissions and is deporting migrants.
They come into the office, they have increased stress, increased anxiety.
Dr. Catherine McKenzie teaches at Yale and treats refugee families.
Obviously, I'm a doctor. I want people whom I see as patients to be healthy, mentally healthy and physically healthy.
Conference organizers say they've seen attendance of 1,000 cut in half because some U.S. delegates are afraid they'll be hassled at the border on re-entry. They plan to publish a statement out of this conference, which they'll submit to a major medical journal.
Together, we have a shared voice and we share values, and so we're hoping to put together a statement in support of refugee and migrant rights and their right to health.
Their hope is strength in numbers can help raise awareness for refugees and migrants everywhere. Shayna Luck, CBC News, Halifax.